you need to understand how much is the weightage of medicine. Okay, so if you study medicine for 1 hour, you're going to get only 33% of the questions. Okay, but in medicine is not like that. So you should have very much smart approach for medicine. Important technique for prioritization is the Mosco analysis. Okay, the Mosco technique is very much useful. Yes, in your entire preparation for medicine, this is the most important image. I'll tell you why. Next, which are the important Qbank modules? Take a screenshot of this also. Okay, these are the important Qbank modules, and these Qbank modules try to solve all questions. Hello everyone, I am Dr. RMD, pediatric resident at PGIM at Dr. RML Hospital, New Delhi. Today we'll be discussing the most demanded video in the last 2-3 weeks, that is how to study medicine in 8 days. According to the schedule that I released for NEET PG 2025, medicine is supposed to be finished in 8 days. And the burning question everyone is asking right now is how to finish medicine in 8 days so that you don't lose anything for NEET PG. Okay, so these were the queries that I got. Okay, to know why it is difficult to study medicine and is it really needed to study medicine in effectively like through all of medicine, you need to understand how much is the weightage of medicine. Okay, so this I had compiled for NEET PG 2021 to 2023. I had compiled how many questions were asked totally in NEET PG. Okay, these are the number of questions that were asked for each subject, and this was the percentage of each subject weightage in NEET PG last 3 years exams. Okay, and this was the time allotted for revision videos in Marrow. I took Marrow because many of people use Marrow. It is nothing like I'm sponsored by the company or anything. And I took the revision videos time that is available on Marrow app, and I divided it by the total number of questions that are asked. That gives me a crude idea about how much weightage is there for medicine. Okay, and this weightage ratio, it doesn't signify anything. It just tells you how much if you dedicate time for a subject, what is the output that you get. Okay, what is the likelihood of getting a question that, from NEET PG if you study each subject for this many hours. Okay, so if you study medicine for 1 hour, you're going to get only 33% of the questions, and if you study like for example pediatrics during the same 1 hour, you are going to get 84%. That means pediatrics is a high yield, high weightage subject compared to medicine. Medicine is a low yield subject. Okay, so what happens in medicine is syllabus is so much and time required to cover that is also so much, but number of questions asked are not that much in comparison. It is not in proportion to whatever the syllabus is. That means that medicine is a low weightage subject. So for low weightage subject, you need to approach this subject very differently. Suppose you had asked me how to study dermatology or how to study orthopedics, the approach would have been totally different from the approach of a low weightage subject like medicine. So rule number 1 for studying medicine is understanding that medicine syllabus is disproportionate to the weightage. So whatever medicine syllabus is, you don't need to complete everything to get more number of marks. That means if medicine syllabus is like 100%, 70% of the topics are being asked from around 30% of the syllabus. That is the meaning of that. Okay, so it is entirely disproportionate. So if you ask me, should you watch all medicine videos, should you go through all medicine Qbanks? Not at all. So in limited amount of time, you have to go through only important topics so that you can dedicate extra amount of time to those topics where you have sure shot of getting questions. Okay, like for example psychiatry is one such topic where if you dedicate a number of hours, that much you will get in return. Okay, but in medicine is not like that. So you should have very much smart approach for medicine. So what is the right proportion for medicine? So if you notice last question papers, last 7 years of question paper from 2018 till 2024, I have compiled all the data. Okay, topic wise, you will note that all topics are not divided equally in medicine. Not every question comes from each topic according to equal distribution. Okay, so you'll note that general medicine, CVS, CNS, endocrine and RS, these five topics are repeatedly asked in previous year question papers. So if you ask me which of the following is the most important according to weightage, I will tell general medicine. That is because there are less topics to study in general medicine. So that means there are sure short topics from general medicine. So this carries number 1 importance. Second is highest number of questions are being asked from CVS. You see in the year 2024 from both sets A and set B, total 13 questions were asked from CVS. Every year you will see that more than 4 or 5 questions are definitely asked from CVS. So definitely CVS carries the second most significance. Third significance significance is for RS. In the last year itself, 7 questions were asked from RS. So that's why we'll give third significance for RS. Then we have significance for CNS and endocrine also. We'll see in the next slide what is the importance according to years. Okay. So you'll note that from 2018 to 2024, general medicine, CVS, RS, CNS and endocrine, these 5 topics determine 75% of the total topics that are asked in medicine. So now those who are starting your syllabus from GIT, thinking GIT is easy to study, those are planning to start from renals because it is short topic, you guys are already doomed. Okay, so medicine has its own way of approach. Only when you analyze previous year question papers, only then you will be able to formulate a device strategy, a strategy with which you will have least rate of failure. Okay, so what does old pattern and new pattern tell us about medicine? Okay, in old NEET PG, more number of questions were being asked from CNS and endocrine, whereas if you see in the last 3 years of question paper, number of questions from endocrine and CNS has decreased, but number of questions from respiratory system has increased. I don't know the reason. Maybe it was post COVID, that's why there was more importance towards COVID, questions on COVID etc. Okay, but if you see last year question paper also, more number of questions were asked from respiratory system. So we'll be managing our strategy like that only. We'll be seeing the questions, we'll be seeing how to dedicate each time for each topic accordingly only. Okay, so what has changed in 2024? Lengthy questions. Okay, so USMLE type of questions have been asked. So these questions had more clues. Some of the clues were nonsense. There was no importance of that thing. That was meant only to confuse you guys. Okay, so they were misleading at times. There was less time because there was time-wise blocks that were available, set A, B, C, D. Okay, and there were more number of questions from RS and less questions from CNS and renal. This was one trend that was observed in the last year question paper. Okay, so how to deal with medicine, how to finish medicine in 8 days. Okay, that is our question. So one of the famous strategies that is used to prioritize things. By now you would have realized that medicine is not studied by hard work. Medicine is studied by smart work, and for smart work you need prioritization. Okay, and one important technique for prioritization is the Mosco analysis. Okay, the Mosco technique is very much useful. This is used especially in business strategies. So Mosco stands for must, yes, and could have, and will not. Okay, we'll be dividing this as must know topics, should know topics, can know, that is if you have time, and things you won't be needing it. Okay, won't need it. So we'll be categorizing medicine topics according to this, and we'll be devising our strategy. Take screenshot of this image right now, because this is the most important image in the entire video. In your entire preparation for medicine, this is the most important image. I'll tell you why. Must study topics, should study topics, can study topics, and won't be needed. These 4 are the broad headings to study medicine. If you see topics here, these topics are based on different colors and different sizes also. The size of these topics corresponds to their importance in each column, which means in must study topics, CVS, ECG and ABG are the most important topics, followed by diabetes, hypertension, stroke and thyroid disorders and electrolytes. So when you're study in this order. Should study topics will include respiratory system mainly, followed by important Qbank modules. Which are these important Qbank modules? I'll be telling in the next slide. Followed by adrenals. I have specifically mentioned adrenals because I have seen that repeatedly more number of questions are being asked from adrenals, whereas rest of the endocrine other than adrenals and thyroid is not of much use. Diabetes I have already covered here. Rest of the important topics which I noticed was important, okay, but if you study whole session, like if I tell you study GIT, not everything is important in GIT except for celiac and liver disorders. Not everything is important in rheumatoid except autoantibodies. So these are the should study topics. Okay, and what are the can study topics? Can study topics are nephrology, rheumatology, rest of gastrology, endocrine and rest of CNS, and some important pearls. What are these important pearls? I'll be telling you in the next slide. And which topics are not to be studied under medicine? Hemat, onco and infection, because these are to be covered in pathology and microbiology respectively. So if you have not taken screenshot of this image, take it right now, because this will exactly guide you what to study. No one in the history of mentorship has ever told you how to study medicine in this manner, because this is according to weightage of the topic, according to marks, according to PYQs asked in NEET PG with respect to time. Okay, this is a smart strategy. This is not a hard work strategy. So take screenshot of this. This will be the most useful. Take a printout of this and attach on your board on your wall, so that whenever you study medicine, you study according to this. This is not based on my experience. This is based on last 8 years of PYQs. So According to Mosco analysis of our topics and such strategy, we will be dividing these topics into must study, should study, can study and won't be needed topics. For must study topics, now your question will be from where will I study these topics? So ABG, electrolytes, diabetes mellitus, hypertension, thyroid, all these topics are to be studied from main videos or main notes. I would suggest ABG topic study from main videos, rest of the topic study from main notes to conserve your time. Okay. CVS topic study from either your revision notes. Okay, you can study from revision notes if you can finish it within like one day, or you can go through Dr. Deepak Marwa live videos. Under his live video section there is a video on cardiology which you can finish in like 6 to 7 hours. Okay, that I had recommended for last time NEET PG, and that has helped many students also, so you can go ahead with that. Okay, plus you have to solve some important Qbanks of CVS which I have told in the next slide. Should study topics, go through your revision notes. Alternatively, here the most important topic is RS, so I would suggest go through your revision notes itself. Plus Qbank important topics, where to study that from, I will be telling in the next slide. Can study topics, that is our third category of topics, that will include topics like nephrology, rheumatology, gastro, endo, CNS. See, all these topics are not much important, but they have some important things. It is not like you go to exam without studying all these topics. That shouldn't happen. You should be knowing important topics of these from each system. You should be knowing important topics only. Okay, so those are, I felt, is much better explained in his videos, because Dr. Deepak Marwa had taken each system in 5 or 6 hours, which you can easily complete in 1 or 2 days. Okay, along with that we will be covering pearls also in this. Okay, and then won't be needed topics, you are supposed to cover micro, that is infection, and patho you are going to cover hemat-onc. Okay, so you won't be repeating these topics because you don't want to burden yourself. Next, which are the important Qbank modules? Take a screenshot of this also. Okay, these are the important Qbank modules, and these Qbank modules try to solve all questions. How many days to give for this Qbank module, I have told in the next slide. Okay, so these are the important pearls you have to bookmark right now. Whenever you are solving GT, anyways you will be bookmarking pearl, but these pearls are the ones which are to be star bookmark. Also note that I have included those pearls which are not covered in by your main videos or main topics. Like for example, in this I had told which are the topics to be covered from main videos, notes, or from Qbank. The topics which you are going to which you will be leaving by mistake, okay, those are covered in these pearls. Okay, so these are the pearls you need to bookmark right now. So how will be your day? 8 days strategy for medicine. On day 1 you will be covering must study topics. Day 2 also you will be covering must study topics. Day 3 you will be covering should study topics. Okay, from where you have to cover, that also I have told right now. Day 4 and 5 you will be dedicating for Qbank, because there are many Qbanks daily. Like suppose you are solving 8 to 9 Qbanks, 2 days are enough to cover all important Qbanks. Which are the important Qbanks, that also I have told you. Day 6 you will be studying can study topic. Day 7 also, and then you will be bookmarking important pearls, and you will be going through those important pearls and their respective questions also. And on day 8 you will be going through last 6 years of previous year questions. This is your 8 days of medicine for NEET PG. No one will give you a strategy in such a depth. So how to know whether you are on right track? Follow JUXTAMED quiz. By this time I think everyone knows what JUXTAMED quiz is. I won't be going into depth of it. If you have any doubts regarding how to prepare, if you have any hurdles in your preparation, or you're not able to study, or you're stuck in your this one, you can very well attend my membership session. There will be YouTube live mentorship. Tomorrow there will be one session at 9 o'clock. Before that you will have to join this mentorship session. Okay, so remember, for medicine it is about smart work. Okay, so don't work hard, because even if you give 3 months for medicine, still you won't be able to complete medicine. So medicine is everything about smart work. So work intelligent. Okay, so the one who is working intelligent will be going towards success, because he will be having those extra days which he can dedicate to those topics which are which will give actually high yield output, rather than focusing on medicine less yielding topics. This is the take home message that you have to know. Thank you.